Hi, this is Shelley. Down here in Washington, today is a day where the Budget Committee is meeting, and they're working on this big reconciliation package that the Republicans and Donald Trump want to push through. Now, that's a lot of fancy talk, but what it really is, it is how Donald Trump gets the tax cuts that he wants to give to billionaires and big corporations. You know, as a part of that, they're going to lower the corporate tax rate from 21% down to 15%. So if anyone tries to make you feel like you're going to get these tax breaks or that this money is going to go to reduce the budget deficit, don't believe him. Donald Trump raised the budget deficit when he was in office last time because he gave big tax cuts away. That's the revenue that we use, but he gave them to the wealthiest people in this country. And now he wants to let a lot of corporations, many of them don't even pay taxes or are trying to get many loopholes. He's going to reduce their rate even more. It's just unthinkable. But they have to go to make a lot of cuts in the spending that we're doing now to get there. So just one area they're talking about today is Medicaid. Now, people are often confused, like, oh, Medicaid, well, maybe some poor people should pull themselves up by the bootstraps and pay for their own health care, or I have to pay for my health care, why shouldn't they? Well, the fact is, I think we all know how expensive health care is, and in a state like Maine, when many people just can't afford it, or they don't have a job that keeps them covered, they have to go to Medicaid for that level of coverage. In fact, Medicaid provides health care for more than 290,000 Maine residents. That's about a fifth of all of us. And you kind of wonder, okay, well, who is that? Many of them are children, 30,000 children under the age of 20. And we know how vital it is to have health care coverage when you're a kid to make sure those things are covered. 35% of all children in the state of Maine, 39%, almost 40% of moms who are giving birth and their newborn babies are covered with Medicaid. Almost 50% of working age adults with disabilities, people who can't work or they have other challenges who need that medical care. I think one of the most important things that people don't understand is 65% of people living in nursing homes. You know, that might be your parents or your grandparents or your favorite next door neighbor. Their coverage comes through Medicaid. So when somebody tells you, oh, just make them go to work or make them pay for their health insurance, these are people who rarely have the opportunity to do it or who have a job, might have 3 jobs, but they don't have health care coverage, and so they're not covered unless they get Medicaid coverage. It's unthinkable that Donald Trump and the Republicans in Congress are planning to make this level of cuts. We don't have all the numbers. They're in committee today working on it, but to get the trillions of dollars they want to support their tax cuts for the wealthiest, they're going to go to things like Medicaid. There's nowhere else to go to kind of find the fat in government. This is just one area. We're going to keep talking about all the places they're going to cut, but don't let anyone let you think that this is going to come to you. This is going to cut health care for somebody you know, maybe you, maybe your kids, maybe your mom, maybe your granddaughter, and it's going to give it to a wealthy individual. It's just not right.